Okay, so I was looking up some ingredients, bad actors in toothpaste. We talked about fluoride. You're saying that's not necessarily a bad actor.
Well, I would choose not to use fluoride if you don't have cavity issues. Mm-hmm. And if you do have cavity issues, the first thing I would choose to do would be reduce your sugar, reduce your fermentable carbohydrates, master brushing and flossing. Mm-hmm. You're going to take care of the vast majority of your cavity problems if you will do those things. Mm-hmm. And I would choose not to use fluoride. I personally choose not to use fluoride. And I control cavities in other ways. Mm-hmm. And that would be my decision. When you talk holistically, that would be the direction I would go. If we have a patient that has rampant decay and we're struggling, then fluoride might be the best option for that patient.
Yeah. Okay, some other ones: artificial sweeteners, ethanol, surfactants, propylene glycol, of color pigments, triclosan. I guess it's a type of pesticide.
Why do we need pesticide in our toothpaste?
Glycine, flavorings, which we never know what flavorings are, and some other things, carrageenan. So what would you recommend from a holistic approach? What should you look for if you don't want to do the baking soda, because it seems kind of like weird? What would you recommend to look for? What ingredients should we look for in toothpaste?
You should be looking for the cleanest, the most simple, simplistic ingredients that you possibly can. And if they don't give you the ingredients, I wouldn't use them. And because one of the problems that we are seeing, or I am seeing over and over, is that they're only doing like one thing. Like they might remove fluoride, but then they have dyes in there, or they have sugar alcohols. I mean, they have all of these other things that cause all kinds of problems, like apparently pesticides. Why we have pesticides in our toothpaste, I don't know. But we don't need anything else in there. It's, for all intents and purposes, you can brush with water. So then we have to ask the question, what is the active ingredient, or what are we actually trying to get from the toothpaste? Because if you brush with water, you're just brushing with a brush. And so you're using mechanical stimulation to remove the plaque or buildup on your teeth. So then the next is, if we wanted to add something, we could add a little grit. Most toothpastes use silicate, which is ground sand, or you can use baking soda, like we just talked about, or Benjamin Franklin, grind up charcoal, something like that that's going to give you some grit to clean your teeth. So that would be the second level, would be some sort of little bit of grit that you're adding in to your toothpaste. Then you could be talking about any sort of chemical that is, I shouldn't use the word chemical, any sort of additive that is being used for medicinal purposes, such as oregano oil or mint or some essential oil or something like that.
Antibacterial, antiviral type?
Yes, potential microbial aspects of it. Or flavor, a flavor enhancer. A lot of those are designed to kind of give you that foamy reaction.
Which you won't get with just baking soda and water.
No, you won't get that.
It is interesting that we've been trained to expect that. That doesn't really do anything.
No. The foaming action does not dictate whether your teeth are clean or not clean. Yes, it is something that is very common in the toothpaste. And if you're like, I have to have a foaming toothpaste, then you're going to have a lot more ingredients than somebody who says, yes, I want a super clean toothpaste. And one of the aspects, like FYGG, they have on their toothpaste, you need the toothpaste to mix it up so that it doesn't separate. And again, what level of clean are you willing to do? Because if you're like, gross, my toothpaste separated, then you're not happy with that. If you don't care, need your toothpaste, mix it up, and then you can have a much cleaner toothpaste. And if you think about it, you're using something that's potentially been mixed a year ago and it hasn't separated. There's a lot of stuff in there.
A A lot of extra stuff. So the lesson is, just like we should be looking at labels and ingredient lists on our food, we should be doing that with our dental products
100%.
also.